Welcome to Health Matters on Channels Television, the show that gives you information that could help you make informed decisions about your health. It's good to have you join us. I'm Yomi Otaigbe. Are you watching Health Matters alone? If yes, please call your family members, friends, and other loved ones to join in, because our focus today is on a condition that has been described as a silent killer, which can sneak up on anyone at any time and cause serious damage before one can even realize what's happening. The condition? Hypertension, or you can call it high blood pressure. But here's the good news. Hypertension is preventable and controllable. With some simple lifestyle changes and awareness, we can significantly reduce your risk of developing high blood pressure and its complications like heart disease and stroke. So let's dive into the world of hypertension prevention and control. My guests will join me in a moment as we explore the latest tips and strategies for keeping your blood pressure in check. Do stay with us on Health Matters. My guest on the show today is a consultant physician and cardiologist with the Lagos University Teaching Hospital, a professional member of Nigerian Cardiac Society, Pan-African Society of Cardiologists, and American Heart Association, among others. His area of interest includes preventive cardiology, cardiomyopathy, ischemic heart disease, and heart failure. He's passionate about addressing modifiable risk factors for cardiovascular diseases like hypertension, obesity, and so forth. Join me in welcoming Dr. Akisoya Olusegun Joseph. Thank you so much for being with us on Health Matters.
Thank you so much.
Thank you for finding time to join us today.
It's a pleasure.
So as I said, hypertension is a silent killer. It is a very serious health condition and it affects a lot of people. We'll be talking about how, many Nigerians, I know we don't have so much of statistics, but we'll get around that. But what would you say in your years of practice are those factors that trigger hypertension?
Okay, thank you very much. There are many factors that trigger hypertension. And by the way, let's just inform our listeners that hypertension is elevated blood pressure, sustained elevated blood pressure. All right, and the WHO puts it at a blood pressure of 140/90 and above. All right, so what are the factors that predispose? The first, there are so many factors, modifiable and non-modifiable risk factors. Let's talk about the modifiable risk factors because those are the ones we have control over, and those are the ones that make up about 80% of the risk factors for hypertension. So, lifestyle changes, lifestyle issues, intake of high salt intake, intake of high salt, diet, that is a major risk factor for hypertension, and that is very much in our world now. I mean, people take a lot of salt. There are salty meals here and there, salty condiments, and so many things like that. Smoking, sedentary lifestyle, obesity, intake of fat-rich food, saturated fats. All right, these are things that can predispose to hypertension. Okay, alcohol intake is a major risk factor for hypertension. Okay, now we also have aging, that is non-modifiable.
That is the one that we don't have control over.
But then, if you start early to control the ones that we have control over, you'll find out that, aging can be slowed down. So biological age can be 70, while your age, as far as your genetic makeup is concerned, can be 60. But that depends on how far you would have gone in controlling a number of the modifiable risk factors. All right, so aging, the gender, males are more predisposed to developing hypertension until the protection, all right, enjoyed by the female gender is removed during menopause, after menopause. All right, so postmenopausal the risk equalizes. All right. Then race, black race are much more at risk of developing hypertension compared with the other people, Caucasians, Hispanics, and co. So these are non-modifiable risk factors. And then genetic predisposition. All right. Of course, genetic predisposition can be in two ways. It can be non-modifiable. Genes received from the parents. If parents are hypertensive, the offsprings are more likely to be hypertensive. But then there can be other things that can, bring about genetic mutation. All right. High exposure to irradiation and things like that can cause some genetic damages that can predispose someone to hypertension. So these are things that we need to look at, and these are things we need to deal with. All right.
Okay. You mentioned that 80% of those triggers for hypertension are things that we can control.
Absolutely.
And you mentioned salt. I would think that salt is also very important in the human body.
Definitely.
So at what point does it become too much?
Okay, fine. So what I tell people is that if while eating, the salt content in your food is so much to the point that you can perceive it by your taste
can
bud.
taste it.
Yeah, you can taste it. All right, that is already becoming a bit too much. All right, so usually less than 300 grams. All right, and then it can even go a bit lower for those who are hypertensive, those who have target organ damage already going on, stroke patients, heart failure patients, and things like
300 grams in a day?
A day, less than 300 grams per day.
If
what
we
I
use
tell
the
people,
teaspoon to measure that, how would it look like?
So to 1 to teaspoon, depending on the kind of teaspoon you use. But what I tell people is this: a more practical way is that when you're eating, reducing your salt intake should be such that when you taste the food, even though there's salt in there, your taste bud should not be able to appreciate it. That on its own would have greatly reduced your salt intake.
So that's for salt. Sedentary lifestyle, that's you're not exercising.
Yeah, you're not exercising.
Let's talk about that.
Okay, fine. So for sedentary lifestyle, we're getting more, involved in so many things, but less, active. Okay, so you find out that somebody, goes to work from 8 a.m. to 5 p.m., very busy, quite productive, but then as regards to physical exertion, little or nothing is being done. The person is not moving around, is not, just stays there, not walking, not jogging, not skipping, nothing, no exercise before going to work. And then while at work, stays, quite busy and not, doesn't get up to even walk around. So what we tell people is this: as much as possible, try to move. Sit less, move more. Sit less, move more. If you can exercise 30 minutes per day for at least 5 days a week, that will be very fine.
Some people will ask, if I walk a long distance, it should count, right?
Yeah, it definitely counts. So WHO talks about 10,000 steps per day. Okay, now that has even been reviewed, that for those who are very active, 8,000 steps per day can actually be, quite good, protective. But then I must tell you that to achieve that, you must put in some work. You can't sit from 8 to 5 or 8 to 6 and expect to achieve that until you put in an extra work. All right. So it's very important that we sit less, that we move more. And there are a few tips that we can, adopt to actually increase our physical activity. So for example, I tell people that, we receive calls, more often than not. You can make your talk time your work time. So while receiving your call, you can make up your mind that, okay, what I'm going to do is this. Each time you may not be able to do that every time, but most times, all right, and if you can do it every time, that will be very fine. When calls come in or when I make a call, I will converse with the person at the other end walking. You can pace in your room, you can pace in your office, you can pace anywhere you are. Just make that call time a walk time, your talk time a walk time. And that would have really, really helped to increase your step count, reduce, inactivity, physical inactivity, and ultimately increase, your well-being. Now, sedentary lifestyle can predispose to hypertension, predispose to diabetes, predispose to premature aging, predispose to stroke, heart attack, heart failure, reduces sexual performance. So there are a lot of things that
attached
have
to it.
do, yes, with sedentary lifestyle. It's not about hypertension alone. There are so many things. It's also linked to even some cancers. All right. So this is something we need to get our people to do. Please move more, sit less.
So you mentioned earlier also that hypertension must be sustained. So are you
Blood pressure
saying
must be sustained. We don't want hypertension to be sustained.
Okay,
we want to
the
control it.
No, when we say
Elevated blood pressure.
hypertension, that means it is sustained.
Sustained elevated blood pressure.
So if someone has, for instance, elevated blood pressure just today,
right,
and maybe for reasons of exertion,
right,
and it doesn't happen again, are we going to say that person is hypertensive? Or it will be something that must be checked?
Yeah, so it would be nice to check periodically. So, I mean, if a patient comes in, or if someone walks in or checks his blood, his or her blood pressure, and blood pressure is about 140/90, and that's the very first time. I mean, to tell the person that you are hypertensive may not be right. Especially if you ask, have you been checking your blood pressure before? Has it been elevated at one time or before? If the person affirmatively tells you no, then you can't label that person as being hypertensive. You need to check it some other time, maybe the next day, and the next day you'll tell the person, okay, you know what, in 2 to 3 days time, come over and let me see your blood pressure chart. All right, that is that. However, there are some blood pressure levels that you will not allow the person to go. If someone comes in and you check the blood pressure and it's 200/110 millimeter mercury, you cannot tell that person to go home. Even if he tells you, even if he or she tells you that this is the first time he's been told, you cannot allow that person to just go like that and say, okay, come back come back tomorrow or come back in 2 days time. The person may present, in your clinic as a doctor, or, present in, another facility, having stroke, heart attack, or heart failure, or may not even have the chance for you to react.
Yeah. So
the person may just drop dead.
Yes. I have been at a medical outreach, and someone has a blood pressure of 190/, I can't remember the lower part of it.
Okay.
And they were telling the man, sit down, and he's saying, I'm okay.
That's it.
I'm okay. And that's the silent part of it.
Right.
Are there other signs or symptoms that one can also look out for, aside from making sure that we check our blood pressure regularly?
Okay, fine. So first of all, the only way by which you can know that your blood pressure is high is by checking your blood pressure. There's no other way. Hypertension can only be diagnosed by checking the blood pressure.
How often should we do that?
Well, for somebody who is not hypertensive, someone who does not have a family history of hypertension, I'll say, okay, as often as you can, maybe once in a month, once in 2 weeks, once in a week. But those who are at risk, check. If you can check every day, the better. The more frequent you check your blood pressure, the better for you. If you're not hypertensive and you've checked and the blood pressure is really low, maybe once in a week or once in 2 weeks, there's no hard and fast rule to it. But for those who are hypertensive, please check, as frequently as possible, maybe once a day or once in 2 days or once in 3 days, at least, because you are the first stakeholder for one who is hypertensive. If anything happens, it's that person that will be at it. Okay. So the first thing is that blood pressure must be checked. That's the only way you can diagnose hypertension. However, there are, features that can points to the fact that, look, you've got to check your blood pressure. Something is going on here. Number one, hypertension is a silent killer. And when we say silent killer, it means that majority of people may not have any symptoms. And that's why we say that, those who say, oh, I know when my blood pressure is high. It would have been high for a long time before you even get to know. So check your blood pressure. That's one. Two, there are some non-specific symptoms. This person is just having malaise, not feeling too strong, not up to it, just feels a bit weak. This is the way I describe it: not sick and not well. You are well enough to go to work, but you know that you are not strong. You know in your body that you are not well enough the way you used to be. That can be a pointer to hypertension. Unfortunately,
when it gets to that level,
people will go to chemist or go to this and that or go to a lab. They'll say, oh, you have little typhoid, little malaria. This issue of little typhoid, little malaria killed so many people, much more than the typhoid and malaria itself. Because instead of checking the blood pressure, the person will be given anti-malaria drug and paracetamol, and sometimes these things can work. All right, reduce not reduce the blood pressure, but reduce the symptoms. And then psychologically, when you feel that you are taking a drug,
you're feeling better, then you think that's
exactly,
what it is.
and that's it.
So
then,
all right,
headache. Again, when people have headache, the first thing they rush to is paracetamol or any of the painkillers. But if headache is persistent, you should check your blood pressure. Hypertension can cause headache. It's established. That's one. That's another. Then poor sleep. All right, somebody may not be able to sleep well. Unfortunately, when one is not able to sleep well, all right, what people tend to say is that, okay, so if that person is not able to sleep overnight, or the sleep was a bit turbulent, if he goes to check his or her blood pressure the next day, an uninformed person will say, oh, it's because you didn't sleep well, that's why your blood pressure is high. That can be correct. Poor sleep can actually is a risk factor for hypertension. However, when the blood pressure is high, extremely, like that person, 190 over this, if you probe deeply into that person, he may tell you that, oh, yeah, I don't sleep too well, or I sleep and then few hours later I wake up. When the blood pressure is extremely high, achieving enjoyable sleep will be extremely difficult. It's like setting the house on fire. You cannot sleep well. All right, so that's another. And then palpitation, awareness of heartbeats. The heart can be running. Some people will say, oh, my heart is running, it's as if it wants to jump out. If that is happening to somebody who is middle age, even young people, because we find out that the age at developing hypertension now is really, really reducing. And the reason for that is our lifestyle have greatly changed. People are more salt loving, more salt consuming, less active, physically active, more intake of saturated fats and the rest. All right, so these things tend to push people towards developing hypertension even earlier than, and that's why many people will say, oh, their parents, developed hypertension when they were quite old. Why am I developing it now? Well, yes, my dad is hypertensive, but then developed this issue when he was about 70. My mom is hypertensive, but developed it at the age of 70. Your lifestyle is different from that of your parents. They took more of fresh things, fruits, vegetables. We do more of preserved things. Okay, we do more of things stored in preservatives and things like that. So lifestyle is
it's very
completely
key.
different.
So it can happen to the young, it can happen to the older people. Yeah. So we are winding down. What would you say is that very important message? I know that checking the blood pressure is because you don't want to wait for the symptoms.
Oh,
sometimes when those symptoms come, then things may have gone so bad. So we should check our blood pressure always, regularly. What else would you add to it?
Okay, fine. So eat right.
And for those who have it, in terms of control?
Okay, for those who have it, eat right. And when I say eat right, less salt intake, less intake of cholesterol, saturated fats. Okay, more intake of fruits and vegetables, more intake of nuts, groundnuts, cashew, and co. But I tell patients, as much as possible, let it not be salted. All right, because I mean, if you spice it or overspice it, you would have reduced a lot of the benefits in exercise regularly. All right. If you think that you don't have time to exercise, use some of these things. Convert your talk, time to walk time.
Yeah.
While you're waiting for your dinner to be ready, you can pace in your room. You can pace in your parlor.
You can exercise on your bed.
You can exercise. Yeah, you can.
That's the one I'm trying now.
Yeah, you can cycle. You can imaginary cycling and things like that. You can do that. Some people will wait for their dinner to be ready for 1 hour and stay glued to the television.
Okay,
while
now,
you're watching,
for
you
those
can
who have hypertension, I've heard some people, once they feel better, they think that you don't have to continue with the medication. They stop by themselves. What's the implication of that quickly, and why is it important to always see the doctor in terms of what medication to take and how long it should be?
Okay, very good question. That is, stopping medication is a pathway to complication anywhere in the world. It is a pathway to complication. Why? If you're supposed to take your drugs and you don't take them, the blood pressure will begin to go up. What people say is, one of the myths is that if they keep taking the drugs, the blood pressure will go down and even go less, much more lower than normal. That's not true, really.
So they have to talk with their doctors to be able to know when to stop, what dosage
not when to stop.
Oh, sorry.
If you feel that
what dosage they should take, and
that's it. I mean, the way I explain it,
because sometimes they reduce the dosage, sometimes they increase it depending on what the doctor finds.
Yeah, and that will help just to balance up things and make sure that your blood pressure is within a range, a safe range where you can live a normal, productive
Thank
life.
you so much, doctor, for your time. I'm sure we need to talk about hypertension. Right. Because that's another condition that a lot of people don't know about. We'd like to say a big thank you for coming on the show today. We've been talking with a consultant physician and cardiologist with the Lagos University Teaching Hospital, Dr. Akinsanya Olusegun Joseph. Thank you once more for your time.
Thank you.
And just before we go, let's check our stories making the rounds on our health news segment.
The Federal Ministry of Health and Development Partners have launched a new program aimed at reducing maternal and newborn deaths in Cross River State. The program, known as the Maternal and Neonatal Mortality Reduction Innovation Initiative, is part of the federal government's effort to drastically cut down maternal mortality ratio, which according to the World Health Organization stands at 993 deaths per 100,000 live births in Nigeria. Maternal mortality remains a major public health concern in Nigeria, with many maternal deaths caused by preventable factors such as bleeding, infection, and high blood pressure. Experts attribute these deaths to weak health systems, poor access to skilled care, and cultural barriers that delay treatment, amongst other factors. The federal and Cross River State governments are now targeting a 30% reduction in maternal deaths by 2028 under the new 5-year initiative.
The Federal Ministry of Health will continue to provide her leadership role, policy direction, and support all the states to ensure that we crash maternal and newborn mortality in the country. The MAMI initiative, therefore, represents for us a unique opportunity to strengthen collaboration and harness innovation and develop sustainable solutions that will improve maternal, newborn, and child health outcomes.
Already, our health infrastructure is coming up. We have engaged a lot of human resource for health to man these health facilities. And we are also looking at how we will activate our ambulance system in the state so that these pregnant women can easily be moved from where they are to the nearest health facilities.
The World Health Organization has warned that less than 1 in 3 countries around the world have a national policy to address the growing burden of neurological disorder, responsible for over 11 million deaths globally each year. The WHO's new global status report on neurology shows that neurological conditions now affect more than 40% of the global population. That's over 3 billion people. The top 10 neurological conditions contributing to death and disability as of 2021 were stroke, neonatal encephalopathy, migraine, Alzheimer's disease, and other dementias. The report shows that low-income countries have more than 80 times fewer neurologists compared to high-income nations, despite the high burden of the diseases. Many low- and middle-income countries lack national plans, budgets, and workforce. The WHO is calling for urgent evidence-based and coordinated global action to prioritize brain health and expand neurological care. In a landmark public health achievement, the World Health Organization has validated the Maldives for eliminating mother-to-child transmission of hepatitis B, while maintaining its earlier validation in 2019 for EMC-TCT of HIV and syphilis. This makes the Maldives the first country in the world to achieve triple elimination. The Director General of the WHO said the Maldives has shown that with strong political will and sustained investment in maternal and child health, elimination of mother-to-child transmission of these deadly diseases and the suffering they bring is possible. He adds that this historic milestone is predicated on Maldives' integrated care, universal health coverage, and partnerships.
Remember to take control of your blood pressure and boost your chances of living a healthier, happier life. That's Health Matters. Thank you for being with us. Stay with us on Channels Television. I am Yomi Otaigbe.